Good afternoon, everyone. This is final year's topic, tetanus, for final year BSc CZMB students. So, tetanus is a disease which is caused by Clostridium tetani. Clostridium tetani is an anaerobic bacterium. It's a strict anaerobe or an obligate anaerobe. So, what are the important features? It has got drumstick-like appearance or tennis racket-like appearance. So, it is a very spore-forming organism. So, terminal spores are produced by Clostridium tetani. It's a gram-positive organism. It's a rot. And Clostridium tetani can be grown on Robertson's cooked meat broth. It can be grown on blood agar. It forms complete hemolysis on the blood agar medium. It can be grown on casein hydrolysate medium. So these are the specific medium for growing Clostridium tetani. So Clostridium tetani produces indole. So it is indole positive. So Clostridium tetani produces toxins like tetanolysin and tetanospasmin. So this tetanospasmin is a neurotoxin. It's an exotoxin and it's a neurotoxin. It has got a very specific action on the nerves. So Clostridium tetani can produce tetanospasmin. Tetanospasmin has got two components. So the B component of the tetanospasmin is responsible for binding to the neuronal endings. A component has got its action at the synaptic junction. So it prevents the release of the glycine and the other neurotransmitter gamma aminobutyric acid. So these are the neurotransmitters which are very much important to pass on the message to muscles for relaxation of the muscles. So tetanospasmin toxin binds to the neuronal endings and it prevents the release of the neurotransmitters glycine and gamma aminobutyric acid in the synaptic junction so that these neurotransmitters are not passing on the message to the muscles. So when the message for the relaxation of muscles is not passed on to the muscles, so it causes continuous contraction of the muscles. So this may lead to spastic paralysis. So muscle spasm is one of the important symptom or typical of the tetanus disease. So muscle spasm is, which type of muscle spasms are caused or where exactly it's going to be caused depends upon the site of the injury. So this Clostridium tetani can be commonly present in the soil. This is a soil bacterium. This can also be present in the intestinal tract of the animals. So this can also be found in the feces of the animals. So the agricultural workers may be prone to the ingestion of the tetanospasmin toxin or Clostridium tetani from the soil. So since this is a very strict anaerobic bacterium, maybe the wounds or the fractures or the umbilical surgery which is done during the time of the birth, right? So if they're all infected, so it may cause, if the Clostridium tetani exists there in the wounds, since it's an anaerobic bacterium, it can grow well in the tissues and it can reach the brain and it can attach to the nerves. So where exactly the spasms are caused depends upon the site of the injury, whether it's very near to the brain or whether it is far from the brain. So the incubation period of the disease depends upon the site of the injury or the site of the wound. So if the wound is very far from the brain, then the incubation period may be longer. If the wound is very near to the central nervous system, then the incubation period may be only 1 week to 10 days. Otherwise sometimes it may take 1 month to show the clinical symptoms of the disease. So the spasms may occur at various sites. So usually it is causing facial spasms. Then it may lead to opisthotonus. This condition is the facial palsy or facial spasms. And there can also be dropping of the eyes. So the upper eyelid may be falling onto the lower eyelid. So this condition is called as ptosis, right? And there can be conditions like opisthotonus where there is facial spasms, and there can be conditions like rhizus sardonicus where there is complete bending of the neck and the throat and also the spinal cord. So the person will be confined to the curved position or there is curvature of the lumbar region or there is curvature of the spinal region. So this condition leads to rhizus sardonicus. And one of the typical symptom of the tetanus is lockjaw. Lockjaw is also called as trismus, where there is what? The complete locking of the jaw. He is not able to move the jaw muscles. So the tetanus can also be seen in various stages. Accordingly, it can be called as neonatal tetanus. So if the mother is having the tetanus, Clostridium tetani infection is not diagnosed or not treated during her pregnancy, then the antibodies may be found in the mother's blood, and due to the passive immunity, due to the feeding, the antibodies may be passing on to the baby and it may give immunity. Otherwise, if the mother is having, it may also lead, if the antibodies are not there, then the baby may also be getting the tetanus. Then it is called neonatal tetanus if it occurs in the infants. Then it may be general tetanus, where the spasms can be caused in any region of the body. There can be continuous contraction of the leg muscles, there can be continuous contraction of the hand muscles, there can be continuous contraction of the cardiac muscles. The persons may feel difficulty in the breathing, that is the spasms of the respiratory muscles, and he feels difficulty in moving. The normal cheek movement may become very difficult, normal eye movement may become very difficult. So this can be called as general tetanus. And sometimes it is confined to cephalic tetanus, where only the facial and the neck region are confined to the spasms, where there is spasms of the cheek and spasms of the eyes, right? And sometimes the otitis media, the ear infection, may also lead to the cephalic tetanus. So all these are different, sometimes it may be localized tetanus, where it is confined to only the face. Sometimes it is confined only to the neck. When it is confined only to the neck or the throat, then the persons may feel very difficult to swallow, or the person may feel very difficult to talk. So these are all the typical symptoms of the localized tetanus. So tetanus can exist in all these types. Yeah, how are you going to diagnose? You can grow the organism on, see, the doctors can diagnose by the typical symptoms of the tetanus, and he can take the sample, blood sample, and it can be grown, the organism can be grown on the blood agar medium or Robertson's cooked medium, and you can observe for the drumstick appearance, right? So these are all some of the simple tests which are done to diagnose the tetanus. Most of the times it is done where it is diagnosed with the typical symptoms. And how are you going to treat the tetanus? So to treat the tetanus, there is a toxoid which can be made from the tetanus. So tetanospasmin can be converted into a weakened toxin. It can be weakened by growing in the non-susceptible organisms, right? And it can be weakened by treating it with acidic pH. It can be weakened by treating with the formalin for weeks. So the toxin is weakened and it is converted into a toxoid, and this toxoid can be given along with the DPT injection, where Clostridium tetani toxoid, tetanospasmin, can be given in the DPT injection, right? And it is the active immunization, and if the child is immunized with the DPT, it gives immunity, because the tetanospasmin, which is weakened, is not going to cause the disease in the child, but it will induce or it will stimulate the immune system of the child, and the antibodies will be made in the child. So this is what happens in active immunization. And passive immunization, in some severe cases or in some emergency conditions, the production of the antibodies to the toxin may take weeks. So till then the patients may not withstand. Okay, so in that case you are going to give passive immunization, where the ready antitoxins are given. So the tetanospasmin weakened toxin is given to the animal, and the animal is going to produce the antitoxin for the tetanospasmin toxin, and this anti-tetanus immunoglobulin is extracted from the serum of the animal, and this is given in case of the passive immunization. And sometimes there can be combined immunization, where in severe cases you need to give the ready immunoglobulins of the tetanospasmin, and you also need to give the toxin of the tetanospasmin. So that is combined immunization. To one arm, the DPT can be given, a tetanospasmin toxoid can be given, and to the other arm, you are going to give the ready antitoxins. And the prophylactic measures can be, see, sometimes a tracheostomy has to be done, where the artificial respiration has to be given